Hello, this is Ed O'Brien, and this is a presentation about my service learning project. I chose to do my service learning project in the Genetic Research Department at the A.M.B. Barsinger Institute, or the ABBCI. The ABBCI is part of Penn Medicine, Lancaster General Health, and is located at 2102 Harrisburg Pike in Lancaster, Pennsylvania. I have worked in radiation oncology at the ABBCI for the last 2.5 years. When I initially started working there, I attended an in-service about genetic research in oncology. I thought the in-service was very interesting and I wanted to learn more about it. I thought doing my service learning project in genetic research would provide me with this opportunity to learn. The contact person for my service learning project was Caroline Malpass, a genetic counselor. I completed my service learning hours between July of 2018 and February of 2019. The population currently served in the Genetic Research Department at the ABBCI is a subset of the cancer population. They are cancer patients referred to the genetic counselor because they are felt to potentially have genetic mutations for hereditary cancer. A majority of the patients they currently see are breast cancer patients, but they also see some patients with ovarian or endometrial cancer. The needs of this patient population include the same needs of any cancer patient and include physical needs like symptom management and psychological needs like managing emotional distress, but they also have unique needs related to genetic testing. For example, there are ethical issues encountered by patients offered genetic testing, like whether or not to be tested or whether or not to disclose the results to their family members. They can also have psychosocial needs, like dealing with guilt, managing family dynamics when considering testing and disclosing results, and dealing with stress related to decision making. For cancer patients at the ABBCI, genetic counselors provide assessment of medical and family history, genetic information analysis, communications with patients and family members, education, supportive counseling, and the follow-up services. I spent time with a genetic counselor during my service learning hours. I learned how to construct pedigrees, which is a tool used to assess genetic cancer risk. A pedigree ideally has 3 generations of biological related family members containing their ethnicities, ages, cancer history with age of diagnosis, age of death if deceased, and a cause of death if deceased. I also participated in patient interviews during which the pedigree is reviewed and the patient received general education about cancer, risk factors, risk reduction, an overview of genetic testing, and the risks and the benefits of genetic testing. It is during this visit that the genetic testing is offered if indicated, informed consent is obtained, and the testing is performed. I also had the opportunity to be involved in counseling sessions in which the genetic test results are reviewed, potential treatment options are offered, and the testing of family members, if discussed, is indicated. In order to set up my service learning project, I first contacted Caroline by sending her an email explaining the objectives of service learning and how I was hoping to do my project in genetics. She offered to meet with me to discuss it. I met with her a couple of weeks later and reviewed some potential objectives I had, and she agreed that it would be a good opportunity for me. My understanding of the role of genetic counselor was limited at that time, so she helped me revise my objectives. I contacted my faculty advisor about doing my service learning project in the genetic research department, and she requested some clarification of what exactly I would be doing during my service learning hours. After providing this information and further revising my objectives, I received approval from the project from both my faculty advisor and the director of operations at the ABBCI, whom Caroline had contacted on my behalf. I work full-time Monday through Friday during the same hours that the genetics department is open. In order to complete my hours, I needed to take some time off of work by scheduling vacation days. Caroline was willing to be flexible with the days I scheduled myself to be in the next department based on staffing needs in my own department in radiation oncology. In thinking about revisions or future considerations, I would have liked to have more continuity in seeing patients throughout the entire process from the initial interview to the follow-up and counseling sessions. Although I was able to see each step of the process, I think being with the same patient during the entire process would have provided me with a unique perspective. The lab work is typically sent out to California, and then the turnaround times for results to come back is generally 2 or 3 weeks. This also made it difficult from a scheduling perspective to be available when the patients I had been with during the initial interview were getting their test results back. The counseling sessions with the patient, the family, the genetic counselor, and the medical director were only held on certain days, typically based on the medical director's schedule. So I was only able to participate in a couple of those. A student with a more flexible work schedule may be able to work around some of these issues and participate more fully in the care of just a few more patients. There are many issues encountered by cancer patients that are seen in the genetic research department. I've mentioned some of the social or the psychosocial issues already, like the ethical issues surrounding the genetic testing and family members, as well as the psychological impact, like the fear of getting results back or the guilt associated with passing on gene mutations. Although I did not see any political issues firsthand, Caroline mentioned that her department relies heavily on the federal funding for genetic research. There was a nurse who assisted the counselors with a lot of the patient education and construction of the pedigrees, whose position was entirely supported by grant money. Her position was only temporary and was eliminated after all the funding ran out. Potential economic issues encountered includes barriers to access, as not all patients who should be offered testing are offered testing, and many patients do not live in an area where a genetics professional is available. Some insurance companies will only pay for testing if a patient is seeing a genetics professional as part of their care. Some patients are not able to afford the testing because of the lack of inadequate insurance coverage. At the ABBCI, the blood work drawn for genetic testing is sent to a lab in California. The lab will contact the patient prior to running the specimen if the patient has a high out-of-pocket cost. The patient can decide whether or not they want to pay for it. Sometimes the genetic counselors are able to use the grant money to help the patients with these costs. There are some cultural issues encountered by this population as well. Because we're talking about genes, there are some populations, like the Ashkenazi Jews, that have a significant higher propensity for BRCA1 and BRCA2 genetic mutations. Research has also shown some disparities in testing and genetic counseling for ethnic and racial minorities, like minority women, like African Americans, have a lower rate of use than white women. Since diversity is not represented in the data available to interpret results, because fewer ethnically and racially diverse people have taken part in genetic testing, these variants of unknown significance create challenges for the clinical environment. My service learning project's objectives were as follows. During service learning hours, the student will participate in at least one genetic counseling session. Upon completion of service learning hours, the student will be able to identify 2 potential ethical issues associated with genetic testing, interview a minimum of 2 patients, family members regarding their genetic screening, identify a minimum of 4 cancer-associated genetic mutations, and list a minimum of 3 potential social problems faced by patients with cancer. I was able to meet all of the objectives I had hoped to during my service learning project. I participated in many patient interviews and counseling sessions during my service learning hours, which allowed me to meet my objectives. Caroline provided me with some educational materials, and she was always available and willing to answer any questions for me. My service learning project had more of an impact on me, both personally and professionally, than it probably did on the population I served. However, there were a couple of patients who I met in the genetic research department whom I later cared for in radiation oncology. One of these patients felt relieved to learn that she would see me, a familiar face, for her radiation treatments after getting to know her during her initial interview. I think me having a better understanding of genetics will help me to provide better overall care for my patients having radiation therapy who have or will see the genetic counselor. I feel like I learned a lot during my service learning hours, and the experience was really beneficial for me. Being able to apply and witness firsthand what I had learned about in my ethics class, like the principles of autonomy and justice from a patient standpoint, I found far more interesting than reading about them. The majority of the patients I saw were breast cancer patients, but it was more interesting to see how each of them processed the information about their genetic testing a little bit differently. Some were fearful of passing on the genetic mutation to their daughters. Some felt enlightened and empowered to learn more, while others voiced concern that their children did not want to know the genetic test results because they've already had Huntington's disease in their family. It was also interesting to see the impact it can have on a family. I had a younger woman with ovarian cancer who wanted to pursue genetic testing. She had 2 young daughters. Her husband came with her to the initial appointment, and I could tell it was causing a lot of emotional distress for him, thinking not only about his wife, but also his daughters. I take care of a lot of cancer patients every day in radiation oncology. I get to see how a cancer diagnosis not only impacts a person in a multitude of ways, but also their family. Genetic testing adds yet another dimension to their diagnosis. I now have a better understanding of genetics in relation to cancer, risk factors, risk reduction, and treatment options. Understanding the ethical issues some of these patients encounter, as well as the social justice issues that exist in oncology nursing, I think will help me to provide a better care for the population I already serve by respecting autonomy and being an advocate for the underserved. The experience reinforced the importance of protecting the health information of patients we care for. The genetic test results were not disclosed with anyone but the patient, but the genetic counselor said some of the patients have expressed concern about health insurance and life insurance coverage, or whether they would be discriminated against. The experience also reinforced the importance of continuing education. Genetic research is a growing field and is changing cancer care, so I would like to continue learning more about it. These are my references. Thank you for listening to my presentation.